If you've been taking Losartan with Amlodipine for years, there's something you need to understand today. The biggest danger is not always the pill in your hand. It's not the prescription bottle sitting quietly on your kitchen counter. It's not even the possibility of a side effect. The biggest danger is not knowing whether these medicines have been quietly protecting you or quietly warning you. And after 5 years, that difference matters far more than most seniors realize. Because while some people on this combination are enjoying steadier arteries, healthier circulation, lower stroke risk, and better protection for their heart and kidneys, others may be living with swelling, dizziness, fatigue, balance problems, or changes in their blood work without recognizing what their body is trying to tell them. Today, we're going to talk about what really happens after years of taking Losartan and Amlodipine together. And by the end of this video, you'll understand your treatment in a way that most patients never do. Many people believe that once they start blood pressure medication, the story is finished. The doctor prescribes the medicine, the numbers improve, and life continues. But medicine doesn't work that way. Your body is changing every day. Your arteries change, your kidneys change, your weight changes, your activity level changes. Even the way you respond to medication changes over time. What worked perfectly 5 years ago may still be the right treatment today, or it may need adjustment. The problem is that most people never stop to ask that question. They simply continue taking the same pills year after year, assuming that if nothing dramatic has happened, everything must be fine. Let me ask you something. Have you noticed that you get dizzy more often when standing up than you did a few years ago? Have your ankles become puffier by evening? Have you felt more tired lately and blamed it on age? Do you sometimes wonder whether your medications are helping you, hurting you, or simply becoming part of the background noise of daily life? And perhaps most importantly, when was the last time someone explained what these medications are actually doing inside your body? If those questions make you pause for a moment, stay with me, because what we're discussing today could help you recognize important signals that your body has been sending for years. I'm Dr. Natalia Wright, and welcome to Dr. Natalia Wright Senior Health. My mission is simple. I want to help you understand your health clearly, confidently, and without unnecessary fear. Too many seniors spend years taking medications without truly understanding how those medications work, what benefits they're providing, what side effects deserve attention, and how to recognize when their treatment plan needs a second look. Today, we're going to take our time and explore what really happens after 5 years on one of the most common blood pressure combinations prescribed in the world. If there's one mistake I see over and over again, it's this. People assume that if they've been taking the same medication for years, then any new symptom must be unrelated. They tell themselves the dizziness is just aging, the swelling is just aging, the fatigue is just aging, the balance issues are just aging. And sometimes that's true, but sometimes those symptoms are part of a much larger story. The human body rarely starts by screaming for attention. Usually it whispers, then it whispers again, then it keeps repeating itself until one day you're forced to listen. Let me tell you about Harold. Harold was 72 when he first started taking Losartan and Amlodipine together. His blood pressure had been difficult to control for years. One medication helped, but not enough. His doctor added a second medication, and suddenly the numbers improved dramatically. His headaches disappeared. He stopped feeling pressure in his head. His home blood pressure readings looked excellent. For the first time in years, he felt like he had finally won the battle. Life moved on. Months became years. Doctor visits became routine. Prescription refills became automatic. The medication became part of daily life. Then, one afternoon, almost 5 years later, Harold sat across from me and asked a question that I hear constantly. Doctor, what are these pills actually doing to me now? Am I healthier because of them, or am I creating a different problem? That question stopped me for a moment because it was exactly the right question. Not because Harold was suspicious of medicine, not because he wanted to stop treatment, but because he finally understood something that many people never realize. The goal isn't simply to take medication. The goal is to understand whether the medication continues to serve your body well. To answer Harold's question, we first had to understand why losartan and amlodipine are paired together so often. The answer is surprisingly elegant. These two medications attack high blood pressure from completely different directions. Imagine your blood vessels as highways carrying blood throughout your body. One problem occurs when those highways become too narrow because the muscles surrounding them squeeze too tightly. Another problem occurs when hormone signals tell those vessels to stay tight and tell the body to hold on to extra fluid. Losartan primarily works by blocking one of those powerful hormone signals. Amlodipine works by helping the muscles in the artery walls relax. One interrupts the command, the other relaxes the response. Together, they often create better blood pressure control than either medication alone. That's why doctors frequently prescribe them as partners. And when they work well, the benefits can be remarkable. Here's something most people don't fully appreciate. High blood pressure is not simply a number on a machine. It's a force. Every second of every day, excessive pressure pushes against the walls of your blood vessels. Every heartbeat creates stress. Every hour creates strain. Every day adds a little more wear and tear. Think about a garden hose that's constantly exposed to pressure that's slightly too high. Eventually, that pressure affects the hose itself. Your arteries experience something similar. Over time, uncontrolled blood pressure can stiffen arteries, strain the heart, damage kidneys, injure delicate blood vessels in the brain, and increase the risk of stroke. That's why blood pressure treatment matters so much. The real benefit isn't what happens today. The real benefit is what doesn't happen 5 years from now. No one wakes up and says, "My stroke didn't happen today." No one says, "My kidneys feel protected this morning." The greatest benefits are often invisible, and because they're invisible, people underestimate them. This brings us to something extremely important. Many seniors focus entirely on how medication makes them feel today. But good blood pressure treatment is often protecting organs you'll never consciously think about. Your brain, your heart, your kidneys, your eyes. Every day those organs benefit from healthier circulation. Every day they experience less mechanical stress. Every day the medication is quietly working in the background. The challenge is that the body often notices side effects more than it notices protection. That's human nature. You notice swollen ankles. You notice dizziness. You notice fatigue. You don't notice the stroke that didn't happen. You don't notice the kidney damage that was prevented. You don't notice the heart muscle that avoided years of extra strain. And that's why conversations like this are so important, because understanding both sides of the equation helps you make smarter decisions. Now let's talk about what often happens during those first weeks on losartan and amlodipine. Many people expect to feel dramatically better immediately. Sometimes they do, but sometimes the opposite happens. You may feel a little lightheaded. You may feel tired. You may experience mild headaches. You may notice your heart beating differently. You may feel slightly off balance. For some patients, these changes are temporary. The body has spent years adapting to higher blood pressure. When pressure begins to normalize, the circulatory system often needs time to adjust. It's similar to walking into a dark room and then stepping into bright sunlight. The eyes need time to adapt. The cardiovascular system often behaves the same way. The important thing is understanding the difference between temporary adjustment and a persistent problem. That's where monitoring becomes essential. Because what happens after 5 years isn't determined only by the medication, it's determined by how well that medication fits your body. And here's where many people get surprised. Sometimes the medicine stays exactly the same while your body changes completely around it. Imagine losing 20 pounds. Imagine becoming more active. Imagine improving your diet. Imagine finally treating sleep apnea. Imagine reducing stress. All of those changes can improve blood pressure naturally, which sounds wonderful, and it is. But if your blood pressure needs decrease while your medication remains unchanged, the treatment that was perfect 5 years ago may suddenly feel too strong. This happens more often than people realize. You start standing up and feeling slightly dizzy. You bend over in the garden and feel unsteady when you rise. You get out of bed and need a moment to regain balance. You begin grabbing furniture occasionally without even realizing you're doing it. At first, it seems insignificant. Then it becomes more frequent, and eventually, it begins affecting confidence. This matters because falls rarely begin with dramatic events. Most falls start with tiny moments of instability, a brief loss of balance, a slight dizzy spell, a moment of weakness, a quick shift in blood pressure. One small event that seems harmless until it isn't. And that's why understanding what your medications are doing after 5 years is so important. Because long-term use doesn't automatically mean the medication is wrong, but it also doesn't automatically mean the medication is still perfect. Your body deserves regular reevaluation. Your treatment deserves regular review. And there is one side effect that often becomes more noticeable over time than almost any other. It affects millions of people. Many seniors mistake it for aging. Many doctors see it every week, and surprisingly, it often begins with something as simple as looking down at your feet at the end of the day and realizing they don't look quite the way they used to. Part 2. That brings us to one of the most misunderstood parts of the 5-year story, swelling. The moment many people hear the word swelling, their minds immediately jump to frightening possibilities: heart failure, kidney failure, a serious emergency. And while swelling should never be ignored completely, the type of swelling commonly associated with amlodipine is often very different from what people imagine. Imagine pouring water into a sponge faster than the sponge can release it. Eventually, fluid begins to accumulate. Something similar can happen in the lower legs and feet. Amlodipine relaxes certain blood vessels more than others, and in some individuals, this creates a situation where fluid gradually collects in the tissues of the ankles and feet. At first, it's barely noticeable. Maybe your socks leave slightly deeper marks. Maybe your shoes feel tighter in the evening. Maybe you notice mild puffiness after a long day. Nothing dramatic, nothing alarming. But here's what many people don't realize. 5 years is a long time. A symptom that seems small during month 2 can become surprisingly important by year 5. Because swelling doesn't just affect appearance, it affects behavior. People walk less, they stand less, they avoid outings, they stop taking long walks, they become less active, and gradually, without realizing it, the side effect begins shaping their lifestyle. I remember a patient named Eleanor who loved visiting local parks with her grandchildren. Every Saturday, she would spend hours walking trails and exploring nature with them. Then her ankles began swelling. Not severely, not enough to send her to the emergency room, just enough to make walking uncomfortable. At first, she shortened her walks. Then she started sitting more often. Then she began declining invitations. By the time she finally mentioned the swelling during an appointment, she had spent almost 2 years becoming less active because of a side effect she assumed was simply part of aging. Think about that, 2 years. Not because the medication was necessarily wrong, not because she needed to stop treatment, but because nobody had connected the dots. That's why awareness matters. And here's something encouraging. Losartan is often paired with amlodipine because the combination can sometimes reduce the severity of swelling compared to amlodipine alone. For many patients, the partnership works beautifully, but less likely doesn't mean impossible. Even after years of stable treatment, swelling can still occur. Hot weather can worsen it. Long car rides can worsen it. High salt meals can worsen it. Long periods of standing can worsen it. And if you're experiencing persistent swelling, it's worth discussing with your healthcare provider rather than silently accepting it. Now let's talk about something even more important because you often can't feel it happening: your kidneys. When most people think about blood pressure medication, they think about blood vessels and the heart. Very few think about the kidneys. Yet the kidneys play an enormous role in blood pressure regulation. They're constantly filtering blood, balancing fluids, managing electrolytes, and helping regulate systems that influence pressure throughout the body. Losartan works through one of those important hormone pathways. In many patients, especially those with diabetes, this can be incredibly beneficial. In fact, one reason doctors value losartan is because it may help protect kidney function in certain patients. But here's where things become more complicated. Helpful doesn't mean invisible. Protective doesn't mean maintenance-free. the kidneys still need monitoring, and that's something many people misunderstand. Sometimes patients hear that a medication is kidney protective and assume they never need to think about kidney health again. That's not how medicine works. Imagine owning a car with excellent safety features. Those features are valuable, but you still check the oil. You still monitor the tires. You still pay attention to maintenance. The same principle applies here. Kidney function should be monitored periodically. Blood tests matter, lab work matters, and here's why. Changes in kidney function often occur silently. Your body doesn't always send dramatic warnings. You don't necessarily feel your kidneys struggling. You don't wake up one morning and suddenly know something has changed. That's why routine monitoring is so powerful. It allows doctors to detect changes before they become major problems. The same thing applies to potassium. Potassium is one of the body's most important minerals. It helps regulate muscle function. It helps regulate nerve signals. Most importantly, it plays a major role in heart rhythm. Losartan can influence potassium levels. Again, this doesn't mean the medication is dangerous. It means monitoring matters. One of the greatest myths in medicine is the belief that no symptoms automatically means no problems. Sometimes that's true. Sometimes it isn't. That's why good healthcare combines how you feel with objective information like blood pressure readings and lab results. Now let's discuss something that catches many seniors completely off guard: dizziness. Not dramatic dizziness, not spinning room dizziness, the subtle kind, the kind that creeps into life slowly. You stand up and feel slightly unsteady. You bend down and feel strange when you rise. You get out of bed too quickly and need a second to gather yourself. Many people dismiss these moments. They tell themselves they're getting older. They tell themselves everyone experiences it. Sometimes that's true, but sometimes your blood pressure treatment deserves a closer look. Let's consider another patient. Martin retired at age 68. When he first started Losartan and Amlodipine, he was overweight, inactive, and struggling with elevated blood pressure. Then retirement changed everything. He started walking every morning. He improved his diet. He lost nearly 20 pounds. He slept better. His stress levels dropped. Objectively, his health improved. But his medication remained exactly the same. Year after year, no changes, no adjustments, no reassessment. Then, one summer morning, Martin bent down to pick up a gardening tool and nearly blacked out when he stood back up. The medication hadn't suddenly become dangerous. His body had changed. His lifestyle had changed. His blood pressure needs had changed. But his treatment plan hadn't caught up. This is one of the most important lessons I want you to remember. A prescription isn't frozen in time. Your body evolves. Your health evolves. Your treatment should evolve too. And that's especially true after 5 years. Because 5 years is enough time for major changes to occur. Weight changes, activity changes, diet changes, kidney function changes, heart health changes, sleep quality changes, everything changes. Yet many people continue taking the exact same treatment without ever asking whether it's still the best fit. That's not necessarily anyone's fault. Life gets busy. Appointments become routine. Refills become automatic. The medication becomes invisible. And that's where problems can begin. There's another issue that deserves attention because almost nobody talks about it: the emotional side of long-term medication use. Think about how many times you've taken your blood pressure medication. Thousands, literally thousands of times. Eventually, it becomes part of your identity, part of your morning routine, part of your life story. You stop thinking about it. And strangely enough, that's both good and bad. It's good because consistency is important. It's bad because familiarity can create complacency. People stop reporting symptoms. People stop asking questions. People stop reviewing their treatment. They assume that because they've taken the medication for years, everything must still be appropriate. But medicine isn't a set-it-and-forget-it process. The safest patients aren't the ones who never ask questions. They're often the ones who stay engaged, the ones who remain curious, the ones who continue paying attention. Now I want to discuss something that surprises many viewers. Amlodipine can sometimes affect the gums. Yes, your gums. Most people never expect their blood pressure medication to have anything to do with dental health. Yet some individuals taking amlodipine for extended periods may notice gum tenderness, swelling, or tissue overgrowth. It's not the most common side effect, but it's common enough that it deserves discussion. The challenge is that people often blame everything except the medication. They blame brushing technique, they blame aging, they blame genetics, they blame dental hygiene. And sometimes those factors do contribute. But if you've been taking amlodipine for years and your dentist repeatedly mentions gum changes, it's worth having a conversation with your healthcare provider. Again, not panic, not fear, just awareness. That's the theme running through this entire discussion. Awareness. Because awareness leads to better conversations. Better conversations lead to better decisions. And better decisions often lead to better outcomes. Now let's address another dangerous myth. Some people believe that taking blood pressure medication for years means the medication is slowly building up inside the body like poison accumulating over time. That image creates a lot of unnecessary fear. In reality, that's generally not what's happening. These medications aren't simply stacking up year after year. The real question isn't whether they're accumulating. The real question is whether they're still appropriate, whether they're still effective, whether they're still balanced correctly for the body you have today. That's a completely different conversation, and it's a much more useful one, because the danger isn't necessarily long-term use. The danger is long-term use without monitoring, long-term use without review, long-term use without asking whether the treatment still fits your current reality. And in part 3, we're going to explore one of the biggest mistakes seniors make after years of successful blood pressure control. A mistake that can quietly undo many of the benefits they've worked so hard to achieve.